Good morning. Good morning. I'm not usually in studio at this time. And this is a very special occasion. I've got a guest in studio. I love when people come to visit. Mark Wagner here, Dental Bytes. And without further ado, I'll just, instead of fumbling around awkwardly while you watch me here, let's get started. I have Dr. Fazel in studio here. How long was the commute this morning?
45 minutes. It's not that bad.
That's not that bad.
It was okay. Yeah.
It's not record breaking. I've had people here from Winnipeg. I'm just kidding. It's thank you so much for making it out here. It's always nice to talk to people in person, and
100%.
It's less stuff for me to less buttons for me to mess up.
Yeah. No, absolutely.
How was the weekend?
Pretty good. Yeah. Just running some errands and hanging out with family, but very good. Yeah.
What do you do when you're down? You are super busy, and we'll get into your practice and what's going on with that part. But what do you do to just disconnect?
That's a great question. I don't know if I ever disconnect, but sometimes, I hang out with my husband. He is very calm and zen, and he always gets me to not check my phone every 5 minutes or not go on my emails. So I get to spend some time with him on the weekends, which is great. I've really been super busy just, doing dentistry and then doing speaking and then content development. And I'm really having a lot of things on the plan for building a website for education. So lots coming up. And so not a lot of downtime, but it's good.
Yeah. And I want to get into how you avoid burnout. You are buying practices, you're speaking now, which is awesome. Are you enjoying doing that?
I love that.
Yeah.
I think that is one of my main passions now. And then I didn't know, it just happened to, happen. And now I really, really do enjoy it.
Yeah, I'm not surprised. Usually, you get poked being the top 1% Invisalign provider. Now, are you the only one in Vancouver?
I am now. Every now and then someone else becomes one in Vancouver, but we've been very consistent 3 times in a row now since 2023. Yeah.
What do you, let's dive into that first. How fun is orthodontics?
I love ortho, and I if you get into why, it's not just the ortho or moving the teeth that got me into that, is that as a restorative dentist, I always struggled with prepping teeth. I did never understand why we prep teeth down to nubs and then restore them back up. So when I learned more about ortho and how it can really set me up as a dentist who could be very minimal, very good, and build things up with a good foundation, I was mind blown that we never learned that in dental school. So here I am, very passionate about this, really wanting to connect the dots together and really set up all the restorative dentists out there to do better dentistry for their patients.
Yeah, and occlusion is such a big deal too,
100%,
right? And your airway. Are you interested? What are you looking at when somebody comes off the street? Yeah. It's, hey, I want Invisalign. It's okay.
Yes.
How does that process look for you?
So for us, we mainly look at how people function, how they eat, how they swallow. Definitely airway is something we check. It's not my specialty. I do have a dentist that I work with who does have more focus on that, but definitely evaluating TMJ, muscle pains. I don't let people walk around with pain. I don't think pain is normal. It's a sign of damage, and we can't just give people night guards and assume that they're healing. It doesn't work that way. So again, that's one of my things to go trying to really educate the public and learn myself. I'm taking COIS and hopefully graduating from COIS next year. Really want to connect the occlusal philosophies to orthodontics and build something that works for restorative dentists too. And again, because not all of us want to do class 2, class 3 correction and 3 years of ortho, but even if we can set up the occlusion properly or be able to assess the muscles and not just kind of prescribe night guards just because we don't know what else to do, doesn't really set the good stage for our patients.
Yeah. What education has been monumental for you? What have you enjoyed the most? It's been COIS. What kind of shines? What's the shiny learning that you've had?
I think three things really set me up. So right out of graduation, I worked in an office which was a Galler focused office, and I took Dr. Galler's Re-Engage course literally right out of the get-go. And right after graduation, I did that, and I learned about starting, my ortho journey. And I think a lot of dentists started there because he's very motivational, very passionate, and gets you excited about it. So I got into it, and then after a year or two, I wanted to do more. So, and at the same time, I was doing Kois. So Kois is also the second person that I would say really, really opened my eyes, because occlusion is such a buzzword right now. People just talk about it, but it doesn't make sense. It's complicated when we learned it in school. But then Kois comes and he just simplifies it. It makes it so understandable and so fun to even look at. So he was the second person. I think Stephen Schalk was like the third person that really affected me, in the sense that actually as a GP, you can do proper ortho and you don't have to do GP orthodontics, which is a very popular term these days to like do shortcut 3-month ortho and feel okay about it. He treats patients to the level of orthodontist, and I really aspire to be that, and I've been doing that. So I think these three people really kind of meshed who I am today. And again, I'm trying to be better and taking more education as I go.
I think, it's that piece is super important. There's always something new coming out, right?
Yes.
That's awesome. Like Shulk, he's practiced, I've been through a few of his courses now.
Yes.
The guy only he's in practice 5 days out of the month. That's wild to me.
That's exactly it. Like once you get your systems and have everything set up for you, and you know what you're doing, you don't have to work as hard. Like you work smarter, not harder.
Yeah,
we say that all the time.
That is a thing.
And same with me. Like now I do travel and go speaking places, but my office is working because the team is very nicely trained. Everyone's efficiently working, and we have a system now. We know how to do things, and it's not just me running the whole show. Everybody's really responsible for making the office work.
Let's dive into that. Systems.
Okay.
Yeah, how important is that, right? Like you just alluded to that. Like what are 3 key things that you've set up that you can now take a deep breath and go and leave your baby behind?
I think the main thing is having people responsible for certain tasks. I mean, my office manager, of course, is a big, if Amy wasn't there, I probably wouldn't have been able to do any of the stuff that I'm doing. So Amy's been running the show and making sure everyone's doing the right thing. For my team to actually know why we do the things we do. We all have a purpose. We all care about what we're doing. And I find this is very lacking in our dental industry, where team members don't really know why they have to take a scan, why they have to talk about aligners. They just do it because they're told to, or they know how to, but they don't really care for it as much because they just don't have a purpose about it. So that's one thing.
Why? In your opinion, why is that?
I think it's the lack of communication, the lack of leadership. It's really, soft skills is something that's missing from the dental field quite a bit, just because we never got trained properly in dental school. I mean, every individual in a dental office is trained separately. Our hygienist has been treated independently, our dentists, our teammates, everybody's learning things on their own, and then they come to this office and they're supposed to form this team, which doesn't really work that way. You gotta really know how to work in a team. And then as dentists, we have to know how to lead a team. Leading and being able to have people follow you is not just, you just start doing it. You just have to really educate yourself, be involved with it. It takes time. It takes energy. You have to spend time with your team. You can't just have it all happen all at the same time on its own.
And you're taking responsibility for your destiny and for your practice too, right? That's a huge part of
100%.
it. How do you motivate? What's your motivators? How do you keep your team contributing and being a part of it's your vision at the end of the day, but how do you allow them to be a part of that?
I think the main thing is, again, first of all, finding what makes them happy. Make our purpose their purpose, and make sure they understand why they're doing what they're doing. And again, some people might have different motivations for doing things, but just getting to know your team and what they like and what pumps them up, what makes them excited, is how I go about it. And I really spend the time to get to know my my staff, like everybody from my hygienist to my CDAs. I know what makes them happy. I know how to inspire them because of knowing them personally and what type of a person they are. So again, taking the time to getting to know your team, it might sound like a lot, but it just makes your office systems work so much better that it's worth it. Totally worth it.
It's a human-driven world, right?
100%.
Like I think, systems are important, obviously, but, do we miss the whole human part of things? Like with all, you're rolling around with all this technology, all this knowledge. Mm-hmm. Do we miss the human part of it?
I really think we do. I think we, even in courses, like all we talk about is how to have better systems or how to monitor things and track production better and all that, but nothing about the psychology of human behavior. I'm a crazy psychology geek. I studied biopsychology in undergrad. You did too? Yeah. So that's why I do get it from a human level when you talk to someone, how to inspire them, motivate them to really have a shared purpose with you and not just giving people something like a task to do without any guidance, without any passion for it.
Are we at risk? Are we at risk with how things are driving forward? We can dive into AI, all the software that you have at the front end, and you're, looking at reports and looking at production. Like, where do you find balance in it all?
I personally don't think we're at risk yet, maybe one day, but right now I still feel like there's a lot as a human we can bring to the table. But AI, I right now leverage it as something that's really helping us do better. I used to resist even like asking a question from ChatGPT because I'm like, I'm smarter than that. I don't need that. But now I actually, when I need something, like yesterday I was reading an article and I'm like, can you show me more articles like this? And it gave me like 4 more articles. I'm like, why not use this? Like, it's so awesome for me to be better and do better. And I don't think it's at risk yet, at least from my standpoint. And I'm actually enjoying using AI quite a bit, but I don't know what's to come.
Me too. Like, I'm actually gravitating away from Google and sort of my information queries. I will prompt ChatGPT to curate just something really specific, right? I just find that Google tends to be a bit of like a rabbit hole, right?
Sometimes, yes.
Like ChatGPT, if you prompt properly, that's the science of it.
To be able to ask.
Just to like give you that information on a silver platter now without it being advertised. I bet you the advertisement's coming next. Though.
What I find though with ChatGPT, if you ask very technical stuff, like let's say I ask a very orthodontically related, like specific question, sometimes it makes mistakes, and I've actually corrected it, and I'm like, no, actually this is not right. Yeah. And then it goes back and it corrects itself. So it still has its goods and bads. So you just have to take it with a grain of salt. Sometimes some of the responses, sometimes like, oh, actually that's not true. But if you use it as like a little guideline, especially again, I use it as, let's say I have already scripted something really nice, and I'm like, what do you think? Like, what are your thoughts? And can you give me some feedback on this sentence or whatever? It does work well.
I'm a Marvel nerd. Okay, I don't like Jarvis helped Iron Man out, right? It's like his assistant, right? I think if you don't use it as a crutch to, it's figuring things out for you, but you're using it as a tool to curate, option A, B, and C, and then you use your head. Okay, it's a combination of this. I need this, this, and that. Right. Like, it's not just one prompt. I find that you have
to give it information.
Yeah, you're having a conversation with it for it to be successful.
For sure.
Are you using that in practice or helping you out at any, not clinical stuff, but like in driving the business?
We don't use ChatGPT for that. AI-wise, we use dental monitoring. Yeah. You probably heard of dental monitoring. Yes, so it's one of the coolest AI out there. I mean, it detects little changes for someone who doesn't know. So basically, we monitor our ortho patients on dental monitoring. They scan themselves, and then we see their scan, but the AI will give us feedback in terms of what they're doing wrong and how it's going. It's really awesome how we can leverage that so that you don't really have to have as many in-office visits. And honestly, sometimes you might not see a 3 millimeters of recession starting on a tooth, but it picks up on it. It sends you a little notification and just lets you know to watch out for things like that. So it's really, really cool.
And like monitoring your patients like on a regular, that's so cool, right?
It's so cool. Yeah. Like you can see changes every week. The patient can see their own before and after video as they scan their teeth. So every week, like they get their scan report. It's really encouraging for patients to know that, hey, if someone's out there watching you and making sure your ortho is going well, as opposed to giving people like 20 trays and just good luck.
Yeah,
and,
peace out, bro.
Figure it out on your own kind of a thing. So it's really great. My team is really well trained now on managing it, so I'm not as much involved in actually seeing all the scans all the time. But if there is a concern, if there's something that comes up that doesn't look normal, then I of course jump in and try to help out.
I mean, that's amazing. Like, there's diagnostic tools coming down the pipeline too. They're already out there.
Yes.
Are you using anything
I
yet?
haven't been. I've seen Diagnocat and Parallel AI and all for like X-rays. I still haven't dived into it again. I was a bit resistant with AI in the beginning, I'm slowly like dipping my toes, but. I think it's amazing. It's especially if someone's just starting out of school and really wanting to like learn how to read X-rays better and what to diagnose and not. Taking it with a grain of salt, of course. Again, you always want to use your own judgment, but it's awesome to have that. We also have the NERI with the, iTero scan, which is not AI, but technically like helping with diagnosing cavities. But again, you always have to use your judgment as a doctor, but it's really cool, all these technologies that are out here now helping us.
Well, I heard this the other day. And this is going to be the future. Like, my personal opinion, and it's shared amongst other people that I've respect. AI is going to drive more change than the Industrial Revolution. It's been said that eventually we're going to be doing our jobs, whatever it is, and just managing like a team of
Makes
AI,
sense.
right, to do all these tasks, and that's going to turn the world upside down. But like it's really interesting because I just dive into these things. I'm a complete I was one of the first people that I know of that have dove into ChatGPT and things. Not tooting my own horn, but I'm into the deep end type of person.
Right.
I just find it really interesting. That's kind of seeping its way into everything.
No, of course.
And to just hear folks like. It's a cool tool,
Yeah, totally. I think it's going to change a lot of things. And that's why one of the questions people ask me is like, do you want to have kids? And I'm like, not really, because I really don't know where the future goes and what do I want to tell my kid to become. Like my parents, they knew they want me to be a doctor and they knew I want to, I should grow up, become a doctor. I was a nerdy and I loved sciences, so it worked out. But I honestly don't know, like, what type of doctor is going to be having more success in 10 years? Like, how is that? Is radiology going to be around? Like, what if, everything goes on AI and we can detect every single type of problem, through AI, and you don't really need the amazing field of radiology, which is, I love radiology. I wanted to I was thinking about becoming a radiologist at one point. So AI is really changing the dynamics of what's going to happen in the future. And that unknown is actually giving me like fear of, okay, maybe I don't want to bring anyone else to this world. I need to figure this out on my own kind of a thing. But it's really cool.
I'm teaching my kids how to use it already.
I mean, you got to.
You
can't like be in denial, and like lots of people are, and I'm like,
I don't think it's not going to take over. I
don't think so.
We have this kind of like this taste of the the Terminators or the Matrix. The Terminator and the Matrix was written by the same person, by the way.
Mm-hmm.
Like I think humans have sort of this innate instinctual thing to maybe fear. It's like if you don't have control, you're in trouble, sort of deal. But it's a tool. It's going to circle stuff for us.
Yeah.
It's going to do a really good job of circling things that we know. It's going to be human driven.
Yes.
It needs us for now, right?
Yeah. I don't think it will replace anything yet, but it will definitely streamline our lives and make it easier.
I think it will replace things, but it'll just change things. Like in the Industrial Revolution, you had folks on an assembly line. You don't need that anymore. Mm-hmm. Like you can put those people doing other higher, more value positions to drive our species even further. Like we're going to go off on like a real cool nerd tangent. I'm very cool with that. So are like you're not using it in like at a day-to-day, like what other, I know we could talk about, what other cool tools are you using?
So in office, we use exocad a lot for designing the smiles for our patients. So I used to do a lot of bonding after ortho. I love, putting teeth where they belong, but also shaping them back to where they used to be and how they used to look. So I always encourage doctors, like, after you align your teeth, I mean, you can always manicure the edges a bit, but a lot of times people have lost a lot of tooth structure, so you can just shape them back up to where they used to be. So anyway, I used to do that a lot in the past, just freehanding it like most of us learned. But now with exocad, you can actually design teeth to be exactly how they're supposed to, and then you 3D print the model. Using that model, you can use it as a guide to really do things either through injection molding or through layering techniques to actually get it exactly like what the digital screen shows. So it's just made us such better and more efficient in what we're doing. So exocad definitely is one. I use Prime Scan and CEREC for milling our in-office crowns. So we do 1-day crowns in the office, and patients love that. They hate the temporary. They hate 2 weeks of waiting for that. So lots of stuff like that.
What's your involvement with your laboratory?
I work with a lab in North Van. They're great. So we work with them, again, very much digitally. I've started using Evident, actually. I forgot to mention that. So Evident is, fully digital, and I'm actually really enjoying it. So you give them a few files, like let's say photos or a scan, and they basically like design your whole treatment plan in like a day. And it's crazy. Like you get this thing called dental facial analysis. It's something under COIS. So you take these 5 photos, and then they gave you all the numbers in terms of like how big the teeth are, how long they are, how much the lip moves. And all of that would take me like half an hour to 45 minutes to collect that data for my patients prior for a smile design. But now I just take these 5 photos, takes about 5 minutes. My team takes it, and we'll send it to Evident, and then they give me like a digital copy of everything. It's really cool.
Yeah, I actually spent some time with Evident.
Yeah?
Apollo. They're doing some pretty cool stuff.
Oh, so cool.
They're entrenching themselves in this whole digital realm, and it's the future.
It totally is. And again, embracing it and getting on it faster is the way to go. I mean, even with Evident, it took me like a couple years to start using it and be comfortable with having like a digital lab that doesn't even give you anything.
Yeah.
What's
that all about? Yeah.
Like,
what am I paying
steel
for?
files, like you're just sending me steel, but what do I do with that? But now like with 3D printing and just knowing the workflow of having like before I didn't even know what a steel file means. Like what do you do with it? Like how do you get it out of your computer? But now knowing like how much this 3D printing is gonna, take us up a notch and be able to print everything in the office is really cool. Like
aside from dentistry, like eventually you can buy STLs now and print stuff at home. Like it's cool.
It's so cool.
It's going to become more and more the future, and it's a materials game, I think, more than anything.
Yeah,
right.
It's really cool. Yeah, you can just print your children's toys and everything at home. It's really cool.
It is. It's just more. It just gives you more stuff. Right?
Oh, 100%. It's really fun.
Okay, so when you're walking through the door, like which tool are you like? Oh yeah, this is like I just love this thing. The CEREC, or is it what 3D printer are you using?
I think everything. I actually don't own a 3D printer yet. We are looking into getting one soon, hopefully. But we do have a lab that's very close to us, literally like 5 minutes away. So that's why we got lazy and we just get them to print it and give it to us like right away.
Yeah.
But I'm definitely wanting to set that up. Just been a lot. I've been building another op in my office. So we went from 5 ops to 6 ops and having 2 hygiene days to 3 hygiene days. So all of that takes a lot of hustling. So been busy with some of that. But I'm planning to dive into like 3D printing or maybe like Sprint Ray or something like that down the road.
There's a thought process there. Like it's where does it fit? Like where am I going to utilize it? Like ROI when you're purchasing something, and I'll let you dive into that. Like how do you purchase an item?
In terms of
like a piece of technology, are you the type that you'll research it over 2 years and you'll find out which ones are the best, or do you just like, ooh, that's shiny, I want it?
Exactly, like that's how I've worked like that my whole life. I just bought stuff just because I liked them, not because I did research on them, and it worked out. And I always even say for dentistry, I do things because I'm passionate about it, and the money comes after. It's not about the money first, and then it just works out somehow that, the production, all of that comes just because I'm so passionate and so excited about what I'm doing, that everything works out for the best. So that's the type of person I've been my whole life.
Yeah, I love that. That's great. Let's dive into that. Like, what do you love the most? What do you love the most about doing what you do?
I love getting patients that don't have the education on how to make their teeth better and how they could have had a better bite and how they could have had no wear on their teeth. Having patients like that in my chair, changing their philosophy on dentistry and having them really getting to that perfect bite position and perfect smile. And I also love when patients come to me that are fearful, like nervous patients. I have a lot of those that they just don't want to go see a dentist and they hate dentists just because they don't think we're as cool and as nice as other humans are.
Why not?
I mean, again, it's the barrier. It's the fact that we didn't learn in communication skills of how to get someone to really relate to you as a person. So I love finding those people, and it takes probably a couple of appointments, and then after that it's like they trust you so much and they feel safe because they felt this unsafety of going to the dentist and having post-traumatic stress disorder from that because they just felt unheard. I think a lot of us haven't learned to listen to our patients, hear them out. People experience pain very subjectively. It's very different from person to person. You can't say someone's being dramatic just because we can't feel their pain, because I personally have a low pain threshold, so I know when someone says it hurts, it hurts.
You
so
stub your toe and you're crying.
Exactly. Like, it's just low pain. I don't know what it is, but I feel like I'm very sensitive. So I can understand if someone's like that and really try to relate to them. And having that sympathy, they feel your energy and they can see that you care. And that just goes a long way.
It's a medical profession. Like, how important is empathy?
It's so important. And the fact is, like, dentistry is, I think, is the hardest in that sense that we are operating on a person that is alive, that is, conscious, and they can move around, and we're working on a very intimate body part upside down in a mirror. Like, it's not easy. And a lot of times I even explain that to patients. I let them appreciate, like, your cheek is right there. I'm working on a tooth that's touching your cheek. I have to pull your cheek. I'm sorry, it's not to traumatize you. But even explaining little things like that, it makes so much sense to them because they don't know why we're doing what we're doing. Why are we retracting their tongue like crazy? Like, there's a reason for all the stuff that we do. It's not because we want to traumatize them, but it's actually us really struggling to get our work done, and they appreciate the difficulty that goes into it.
Are you are you cognitive of like all the personality types? Like, do you change your approach based on?
I think I do a lot of mirroring, so that's just me being who I am. So if someone's really like nonchalant and chill, I'll be like that. Whereas if someone's really detailed, I want to know everything specific, I make sure I follow that and give them every single detail. So one really cool tip I give to dentists is if you look at a patient medical history and dental history and they have every single medication from like vitamin D to vitamin A and all of that listed, know that that person's very particular about knowing details. They want to know all of that. But you have patients that just cross a line across the whole history. Like, they just want to get to the point. Like, this is exactly. Yeah. So I even by their medical history and what they write on that, I try to start peeking into who they are as a person. And again, when they talk to you, just see if they want to get to the point, or if they want to see every single x-ray of their mouth, or if they want to know everything about what's going to happen. So really get to know who the patient is and what they want. And another thing is I always ask them, like, do you want to know what I'm going to be doing? Do you want to know the details, or do you want me to just get it done? And try to work with them, because people are very different. Each individual has different needs and different ways of feeling comfort, and making sure to find that is so important.
Are you tracking that in any way? Are you recording that information in patient charts?
We do. My team does most of the recording and note taking. So we do have like a social area that talks about what they like, what they don't like. But thank God I have a good memory, so I kind of see people and I know what type of a person they were or how they react. So that really helps me too. I think the memory of like who the person is really helps.
Yeah. Is there a good story? You got to have a good story about somebody that was like, I just don't want to be here, to them just being totally blown away or maybe drawn to tears. Like, how cool is that?
It's amazing. That's why that's what I strive for. So, I mean, I have a lot of cool stories of patients that were really apprehensive. There was one that when I acquired my Fifth Avenue office, it was owned by an older male Caucasian who was like total opposite of who I am. And I went into this office, and a lot of our patients had night guards prescribed before, and I really wanted to open their eyes to like, hey, let's fix your bite. Like, the reason you're chipping all of your front teeth, your composite fillings are keep falling off is not just because you're grinding in your sleep.
It's
like
function,
it's function. It's the fact that during the day you're chewing, functioning, eating like that. So he was very apprehensive at first, and he's like, who are you?
Who the heck are you?
I know, like,
new
you just
girl
on
the block, right?
Like, you look like you're in your 20s and just took over this practice of telling me I need to fix my bite. Like what are you talking about? But anyway, he was open to it. We talked about it. Took a few sessions of convincing. He had a little baby tooth. He's in his 60s now, and he had a baby tooth at like age 57 that was really loose, and I'm like, there's no point in keeping this. Let's take it out, close the spaces with your teeth to get your bite better. And long story short, we got there. I fixed all of his chipped teeth with bonding. It's been 3 years now that he hasn't damaged any of them, like, which is shocking to himself. But but because he had a proper bite, and when he finished, he was changed as a person. Like, he left us a Google review, like, explaining it. Just brings tears to my eyes reading that Google review. He said he lived 40 years of his life with not smiling and not feeling so self-conscious about his teeth and thinking he has no other choice but to like suffer. And I came along and I really fixed it within a couple years, and it just really touched my heart that someone lived like that for 40 years and no one really gave him a solution other than you need jaw surgery. I mean, yes, a lot of people do need jaw surgery, but what is the alternative? What if someone doesn't want to do jaw surgery? What are we going to do about that?
Right. Like, do you think we forget about like the impact that dentistry has on like people's like their ego, their like how they perceive themselves? So do we forget that part of it?
I think we do a bit, especially in Vancouver, like where I practice. I find people really want to say like they don't care about looks. It's all vanity. Like, who cares? And they all say when we do orthodontics, a lot of them want to say that they're just doing it for function. But when they finish and we do all the nice stuff and the teeth as a byproduct of a healthy bite look better and they have a nicer, more aesthetic smile, then they're much happier. I find their confidence goes up. I think their character changes, honestly. They're just like different, and they feel more excited, they feel more passionate about what they're doing. It just changes them as a human. I find it does change lives for sure. You're
handling dentistry in more of like the full mouth though.
Yes.
Like, you're doing tons of Invisalign. 80% of the world, the dental world, is single unit posterior, right? Like,
yes.
I think that would be long term. That would be a grind if that was sort of your. I mean, I'm not knocking anybody, but on a personal, like, if I was in your shoes, I think it would be fun to just do handle things on the full picture.
Yes,
it makes sense to me.
I think it's because of how we were trained in school to look at a tooth single bite, like one tooth at a time, and never got to look at the whole picture. And again, that's why I'm so passionate about educating other doctors to just kind of step back and look at a face and look at teeth. I mean, now I help with clin checks for a lot of doctors, and sometimes they send me clin checks of people, the teeth moving, and there's no photos. And I ask them, where's the photos? They're like, we don't have photos. I'm like, you are treating a person. You're not treating teeth outside of a jaw, like this has to fit into the face. And it seems so like normal to me that you have to really know this teeth in reference to the face, because why do you extrude teeth in the front if the teeth are already displaying quite a bit? But these things are not taught really well. I think we didn't even learn that much of principles of smile design back in school. I took a lot of courses after school to learn like digital smile dentistry and all that stuff. So it's a lack of education and lack of focus on things that really mattered. And all the focus was just on like probing depths and fixing cavities. I mean, I graduated 8 years ago, and I did more amalgam fillings on my patients than composite in school, which is ridiculous because no one really does amalgam anymore.
Yeah, that's interesting. Why do you? Is it just we're getting a baseline in school? Is that your thoughts? Like, what would you change now? Like, there's an explosion of technology. There's an explosion of material. Is it? Is it a foundational piece that school gives you, and it's up to you to then go and fulfill your destiny as a practitioner? Like, what are your thoughts there? What could be changed?
I think for my dental school personally, I think the main thing was that mainly the dentists that didn't want to practice anymore started teaching. And they say it as a joke that if you can't do it, teach it in school.
Yeah,
so
yeah,
it was, and that was what was wrong. I mean, I remember when we had a couple of doctors that actually had good practices and they actually had patients. We really enjoyed learning from them, but we had a lot of instructors that weren't practicing on patients for over 20 years or something like that.
Right.
So that made it a little bit irrelevant. And the fact that, again, you didn't see people that are practice owners and really seeing the application of doing things other than just like the science or the theory behind things. It was really challenging to learn everything in dental school. So I think maybe because doing dentistry is a lot more productive than teaching in a school. So we don't have a lot of productive dentists who do really well go back to dental school to give back and teach, unless it's really from the goodness of their heart.
Yeah.
So there has to be some way to recruit those people. I don't know, financially, emotionally, somehow, for them to be excited and interested. I mean, I would be one of those people that would go and help, but they basically don't reach out. Like, they just find, I don't know, internationally trained dentists that just came from another country to start teaching these doctors who are really new, and they need to learn from someone who's been here, who's been practicing, who's seen the patients for long term. So there's a lack of proper education, I think, going on for sure.
What's the term? It's wet glove, right?
Is that
the term where it's like somebody's like they're actually practicing is wet glove?
Yes.
Yeah. Like what you said to me, it makes so much sense. So it sounds like, what about like in terms of the curriculum?
I think the curriculum also needs an update. I mean, it's really old school still. Again, we learned amalgams. One of the biggest tests we all failed was like doing an MODBL gigantic amalgam, like filling a whole tooth with amalgam, which I only did on a plastic tooth my whole life, and I failed probably 4 times until I got it. But that was the only time that I had to do that. I mean, now with CEREC and with onlays and with doing like what we can as dentists, why would you even do that? No one really wants that type of treatment. They all want to do the best for their patients. Yes, I get it. If you have to do something temporary, you got to take temporary measures. But again, I don't see the need for spending hours and weeks of training to do something that you're going to maybe do once in your whole career.
Does it give you some sort of foundational knowledge though? Like, is it can you piggyback and it's like, is
I don't think so.
No, yeah. So that seems sort of like
it was
interesting.
No, I didn't find any good results from that. The other thing was we had like a whole module on punching rubber dams and putting it on on plastic models, and I'm always in shock of like, okay, well, I never had to do that.
Yeah.
It's good to know how, and if your assistants can do it, you can help them. I don't think I can now. I haven't done it in like 8 years. But it's good to know how. But we literally had like 3 months of training on punching rubber dams. And I was like, this is ridiculous. Like, I need to work on proper dentistry stuff on my patients.
Yeah. So what tips would you give somebody? They're in school right now. Like, you fast-tracked yourself. Let's face it. Like 8 years and you're seeing so much success. Like, what tips would you give to those folks that are in school right now that are,
I would say get through dental school. Don't think that this is going to be the end all be all for the education. It's sad because we're spending like $350,000 or something on our education to get this license. Yeah. So you expect to come out knowing everything. But I think as long as we know not to put a needle in someone's eye, we passed and we did well. So then you come out and
Is that how you get the tick mark?
Yeah, that's exactly.
She didn't put the needle in the eye. We got another one. Did you get her $300,000?
Exactly. Like just knowing the very basics of, okay, this is not okay or this is okay is fine. And then you just have to start educating yourself. Like the one thing I find with doctors, they're very resistant sometimes to take continuing education, and they say it's expensive. And the amount of give back you get from a course if you apply it, and that's the key. Like, you have to come back and start doing what you learned. Like, when I went to Kois last week, literally I came back, and the day after we started fiddling around with the Kois classes, I started working with Evident, and they were just like, oh, you just took the course and now you're starting to do everything. But that's the key. Like, take the course, but go ahead and apply it in your practice. And it's not hard. It's just taking the time to educate yourself and implement it. And that makes everything so much better. Your patient's going to enjoy it. You're going to really love what you've learned and apply. So I think continuing education is everything.
I've been through some of these courses as not right. I've seen the amount of information in these 3-4 2-day courses. Mm-hmm. How the heck do you retain all that knowledge and then Monday morning come in, get the team now? The team has to be involved in it as well. What's your steps in that? Like, do you bring a team member along in some of these things?
So yeah, sometimes I do, depending on the course, if there is a lot of team information for sure. But I mean, when I go to Kois, there's no team component. You can't really take a team. So I do go back. And again, it's important to educate your team now on what you learned and then the purpose behind it, why we're doing it. We did a full photo day training last Thursday where they actually had some fun taking photos of each other. So I spend a lot of time also getting the team to practice and educate themselves, because when they learn, education for everyone is power. Everyone feels more powerful when they know why they're doing what they're doing. I mean, I love when I see my team talk about ClinChecks to the patients. They understand why there's attachments here, why they would do IPR, what's the reason for anything. And it just makes them feel so much more in charge. And I think as dentists, we don't necessarily teach people why we do stuff. Again, even like the dentistry stuff, like why do you use this bond here versus the other bond the other day, or why do you use this cement versus the other cement? I think with my team, if you talk to them, they know why, and they could talk to you like a dentist. So it's important for them to really learn the why behind everything, and having them trained together, they start practicing on each other. Anytime I have a new team member, I have them scan each other, learn to evaluate each other's bites, things like that. So just spending the time would be, and then again, you might offset a little bit of production, but the value of that for you, it's like unlimited. But it's hard to see that in like a short term, like if you're looking through a box and not having a full 3D view. It's hard to see that, but it has a lot of value.
You have the mind. Like that's where it starts, I think. You understand it like at a very deep level, intimate level yourself. You're a good teacher.
Yeah, I really try to be, yes.
Yeah, so that's a key in leadership, isn't it? Right?
Yes, 100%. Again, if you can motivate and inspire people by educating them, they're going to feel powerful, and they want to educate the patient. So you really get a whole bunch of people that can be a mini Sadaf and present you.
Yeah, that's awesome. And how much easier does that make your life?
Well, so much better.
Like, do you ever feel like a little apprehensive about giving away some of that? It's control, essentially, if they're taking the lead in that conversation.
And that's the thing. Again, I find sometimes doctors don't want to give that control to their team just because they want to have all the power. They want to be the knowledge. They want to be the guru. But it's really it works the opposite. Like, you actually holding things back for your office to succeed. It doesn't make your team look good when they call in to talk to your receptionist and they don't even know anything about how your treatment plans work. It just makes everyone look not very smart. So I find when you give that information to your team and they're all empowered by it, it just makes them excited about what you do. I mean, when I go on missions of like teaching or, going to take more courses, my team is excited with me. I go back and they're like, what did you learn? What was it that we need to implement now?
Yeah.
And they all get excited about my mission with them. So make it a shared goal, a shared purpose. It's everything.
Yeah, I love that. That's cool. Yeah, they're feeling like they're a part of it.
For sure.
That's like, I can't imagine being, in a practice and feeling that disconnect, and you're just clocking in and clocking out at that point, right? If you're not a piece of it.
Exactly. And it starts with you. I mean, as I always tell dentists, like, it starts with us. We have to be that leader to get in and get uncomfortable with situations that we don't like. For example, when I wanted to start our Instagram, now we started with like 100 followers, our Fifth Avenue Dental Center page. And we had not many traction. I mean, nothing was getting likes or anything. So I had a really serious meeting with my team like 3 years ago, and I'm like, guys, I think this is the future. I think marketing's gonna, take a lot of leverage from social media. So we gotta do more of this. And at first they're all like, whoa, like I don't even post videos on my own, social media. They didn't want to do it. So I started doing it alone. Like I just posted goofy stuff and educational stuff. And little by little, they started trickling in. Like they felt bad that I'm just the only one like putting myself out there. So then we became this like big team of doing funny stuff, doing stuff to show our patients that we're not actually very scary. We're very fun. So then we are sitting at like 21,000 organic followers. Our videos, like right now we have a video that's getting like millions, 2 millions or something views. We have lots of videos like that. And it's just because of the human side of a whole bunch of people that actually enjoy their job and they're actually there to do what's best for their patients.
Yeah. And honestly, like you're talking my jam now, right? I see it with direct performance of everything. Like the more genuine it is, the less people have this scent for like if they're being sold on anything, right?
Totally.
And like everybody's got this little device in their pocket where, you know what I mean? Like everybody's informed and stuff. So like, are we just... are we afraid to be ourselves? Like in the beginning, like this was terrifying to me. Like being here, I think it became easy when I just, I'm just myself.
Yeah.
Right?
It's a little bit hard to be vulnerable these days. Like we all live in a world where we want to put on a show and show how life is always absolutely perfect.
It's not.
Nothing. Yeah, no, it's like terrible some days. And I like to share, like some days that I'm not having a best day, I like to share that. I like to show that I'm human. And I see that really connects and resonates with a lot of people because we don't have that authenticity and, vulnerability in a lot of people these days. And we always see the perfection and the great days and the great travels and the business class and all. But there's a lot of shitty days where we are not really having fun or the food sucks or something goes wrong. And to be able to like show that we are human and we all experience that as a whole, community is such a nice thing to see. Yeah.
I like we didn't script any of this. Like it's just, I turn things on and just, I think the best comes out when you just kind of see what happens. Sometimes there is sort of that base plan, obviously, but the real magic happens when it's not manufactured.
For sure, yes.
Let's get into marketing. Like what things are working for you?
So marketing, I didn't really have much marketing in the beginning. With our aligner journey, with our Invisalign, a lot of 90% of our patients in the beginning, I would say, was just people that came to the office for general checkups. And we would just talk to them about how we can improve their bites and improving their function. And as a byproduct, they will have a nicer smile. So that's how we actually got into aligners and got better. And then we got into social media. And I never thought of it as marketing. Honestly, I was just like, I want to just have a brand. I want to put myself out there and create a vision for what I am, who I am, why I'm doing what I'm doing. And then it just brought patients in. Like it was crazy. I would just get messages. We would get phone calls. Like we saw your video on Instagram. We really liked you. And we have our patients follow us. They comment on our videos. They come and joke. Sometimes they reference the video and I'm like, I don't even remember which one. Yeah. But they actually love us. They became a fan of the practice.
You're resonating with people.
And it's really, really something that like changed the way I even see dentistry myself, because I never thought like patients would actually genuinely like to see a lot of our videos and actually comment or come to the office for the video that they've seen or something like that. So that actually brought in patients organically too, without honestly, no money was invested on creating the content more than just having someone that helps us with creating that content. But now we are doing more serious type of marketing for our Invisalign, because I noticed that a lot of patients are really looking for this and they don't know where to go to. So showing that we are very capable, we have all the systems, and most of the patients that come to the consult, they tell us like they see that the way we do things is very much more efficient than wherever they went for a consult. We really are systematic. We've done it so many times now that it's just easy and, really streamlined workflows for us.
But like this is just it here. Like you're the the content and stuff that you're putting out there is just an echo of what's happening in the practice, right?
Exactly.
Like a lot of people are like, what should I post? I just don't know what to post. Like I think before, and you talked about brand too, it's these people are developing a relationship with you. It's a one-sided relationship with you before they even see you. And this is why like it's your digital, like you're going to get more traffic past your business, and this is beyond dentistry. You're going to get more traffic past your business digitally.
Oh, 100%. Again, these days it's just all about being present and having a brand and showing who you are. And people that resonate with you come to you. And that's the fun part. Like most of I would say almost all of my patients are people that actually love to treat. Like they're fun, they're engaged, they really care. I don't have people that are not like my personality, because I guess they don't come to me because they don't resonate with me.
Your content is a filter for it really.
For
that's
sure.
That's what it turns into, and that's the difference between this Google search you need to do that as well, right? But it's you're putting yourself out there, right?
Yes.
And that's not easy for everybody, but that you want to attract people that should come and see you, right?
Exactly. I mean, if someone doesn't enjoy a lot of chatting and like they don't like the bubbliness of our office, maybe this is not the right office for them.
Yeah.
And that's something that they can actually evaluate for themselves. So I think it's always good to bring patients to your practice that actually resonate with your team, resonate with your treatment philosophies. I normally don't want to just have everyone join our practice. I think it's a very nice exclusive club for people that are actually really care for their teeth. They love to have fun, and they're not just there to, be scared or be fearful of being there. And honestly, I find like all of our hygiene patients, they're actually excited for their cleaning. Like they come in with a big smile on their face. They're having a great day at the office. So
I really like the vibe of your office. I'm not kissing your butt or anything. It's a really like I can feel it. You've built like a really cool brand.
Thank you.
Yeah. And that just you're echoing that. So you're doing some paid ads right now?
Yes.
How are you finding that?
We are doing a lot of just the Instagram and Facebook. I haven't done a lot of Google, and I don't know. I find Google a little bit monotonic, and it's not like as human again. So there's just like words, and it didn't really connect with me, honestly.
You're in a battle, right?
Yeah, exactly. Yeah. And it's just like Invisalign dentist, and then there's like 200 other ones, and I'm like, I can't compete with that. I mean, there's 200 offices around me.
You can, but it's expensive.
Oh, it's very expensive,
Yeah.
and I don't think the return on investment for that type of stuff was for me back when I started doing some Google ads. So now it's mainly just Facebook and social media marketing.
You're organic.
All organic, yes.
And like SEO trickles into that. That's part of that pool too. There's your Google right there. Like you spoke about reviews. Like, are you using a system to collect reviews?
We use Podium to get reviews. So every time we have patients in, we'll make sure they get a notification to give us a review. And we also ask, I mean, if we get a lot of patients that just compliment us, like, we really had an amazing service today, this was amazing, we had a great experience, we'll ask them, like, could you please leave us a Google review? We'd love that. So we definitely ask. But we've also gone from, like, I think when I acquired the office, it was 2020, like right in the middle of COVID, and just in a couple of years we got in about, I think, 500 reviews. Like, we didn't have as many, and we just got a lot of people just reviewing us and giving us great feedback, and maybe a couple of 1 stars that I sometimes don't even know where they came from. Like, there's definitely, again, and you always have to talk about the bad too. Like, we are in an industry when sometimes, like, things come and I'm like, I don't even know who is there. We don't even have you in our database of patients.
Some people just drive down the street angry, right?
Yeah. And
you can't help that.
I mean, we had 1-star review a few months ago, and it was like, I called the office and they didn't answer, so they left us, and I'm like, okay, like, I don't even know how valid this is, or like, you would not leave a 1-star for just not having a phone answered. Like,
which is really interesting. A couple facts for you. What's really interesting right now is only 50% of the population out there are trusting reviews now.
Really? Okay.
50%. The whole "you didn't answer the call" thing, and this is like, people are just want like a response right away.
Right.
You're 21 or 22x less likely to convert a patient that makes an inquiry if you don't capture them within the first 5 minutes.
Interesting.
That's people's expectations now.
Yeah, well, everything needs to be instant and
Yeah.
right on the dot, which we try. I mean, a lot of times I tell the girls like you have to answer phone calls immediately, but there's days that like maybe one staff member is sick or someone's stuck into in an appointment. So there's always hiccups in that workflow.
They're
but-
patient facing, right? The front end.
Yeah, exactly.
yeah.
So it's a little harder to always be on the ball and doing things the right way, but we always strive for it. Strive to be instant delivery of service.
Yeah. The best you can, right?
Yeah,
What are you using? Some recare tools, recare software?
We use I forgot the name actually now. I'm blanking out. There's something we use on if you go on our website, it's for booking appointments.
Okay.
So it's just a chat like AI technology.
Okay. Yeah. And it's ported directly into practice management software?
It goes to our practice management, and then they can book their appointment. And I'm blanking out on the name.
That's okay.
Sorry.
That's all right. But like I was just kind of going to dive into that, like the online booking portion.
It's not fully online booking in a sense that like they can go and choose a time and a date and book themselves right away, but they can see what's available for especially for cleaning and exams. They can book it online, and then we get a notification, and they have to, it's like a request pending for them until we approve that this time works, and then they get a notification back that they are actually booked in.
Yeah, the front end needs...
Care Queue, I remember now.
Care Crew. Yeah.
Yes.
Oh,
So
we actually deal with Care Crew.
You do? Okay.
Yeah.
Yeah, it's great.
Great. Are you using the whole analytical piece of that?
We didn't. So we did the whole thing, the whole shebang, and it kind of threw our systems out of whack a little bit because we have really good efficient systems with our like monitoring of like sending notifications and monitoring how patients are booking. So we didn't want to mess with that. So my team was just like, let's just use this for our hygiene and our new patients and exams portion, but we can't really get people to like book their fillings and crowns. Like it's really hard to get all of that because different dentists work differently in terms of the time they need or the equipment they use. So we needed to figure that out on our own, but we let patients book their hygiene and their new patient exams or just regular checkups with going online again, requesting a time that they see available, and then we get back to them and approve it right away.
That seems like to me that's, dealing with care, that's really the most logical, easy.
Yes.
Fail proof, right?
Yeah, exactly. Yeah. Like you don't want to have a messy like request that doesn't work out and the patient gets frustrated because they requested something. And anyway, we made sure it's streamlined now, so it works really well now.
Yeah. What else are you doing for your front end? Like in terms of training?
In terms of training, my office manager is really great at using our software, which is Tracker. So she really knows all the details. It's funny, we had a tracker training one day a couple years ago, and she was showing the trainer how to do stuff. Oh yeah. So I'm like, we don't need these trainings anymore.
Yeah, it's the same. Yeah, it's like the wet glove part, right?
Yeah, she's so good. She knows like how to do the codes and like super codes and all and connect them. So she's really great at training the front end on that. I personally take a lot of time to talk about the human side of things. Like if you're speaking about financial with a patient, how to meet them, how to talk to them so that they understand you're not trying to sell something, but actually trying to work with them. Like when you have people saying like, I need to think about it, most of the time is the fact that they really don't have their questions answered. So they're going to go think about it on their own, asking ChatGPT and Google, but you're there to think with them. So take the time. And it was a little bit of a hard time for them to learn to actually sit with a patient and be okay and comfortable with like thinking with them, because again, people say like, oh, $8,000, let me go home, think about it, and like, okay, bye. And like that's not how it works. You have to sit with a patient and figure out what they need to think about. They probably have questions regarding the treatment, regarding the payment plans, regarding how this is going to work in their lifestyle, and we are the best people to answer that. The other favorite I have is when people say, like, I need to go talk to my husband, like, your husband's a dentist. So with that, again, I always ask, like, there's two reasons why people say they need to go talk to their partner. It's either one is they're the financial decision maker. They're the one who's going to pay. So that means that they actually want to do this, but they need someone else approving this. So then talk to that person who needs to understand the value. Because if they go home and say that I need Invisalign, they're going to be like, no, your teeth are fine.
Yeah.
Right. But if they come to the office and we explain like, this is why we talked about this, and they understand the value of it, then it's a total different story. The second reason people might say I need to talk to my husband, and it goes back to reason one, is that they just want to get out and just figure out a way out that is easy, and that's an easy way out. Yeah. So just figuring out which one it is. And again, I always have my front desk really diving into like what's going on and be comfortable with the awkwardness of like asking more questions. I'm figuring out, and not in a way to be like salesy, but in a way to help people choose what's best for them.
Options. Yeah.
Exactly.
Yeah. They're at the dental practice to get dentistry.
Exactly. Like if they're in that room with you to figure out the finances, they're definitely interested. Like they wouldn't have been walking into that room to, ask about it. So they're definitely inquiring. They want to know more. So I think, again, we have failed as an industry to show our team that this is also this has like another component of sales, but in a nice human way. That's where the gray area is. I think this industry doesn't want to be seen as like like a sales job. Like if you're educated and it's, responsible on your part, right? Mm-hmm. Conservative and given people the right options, the more dentistry you're doing, you're just helping people. 100%. I mean, again, it's all about delivering that vision and that really shared purpose that all of us have. So nothing is just because we want to do it, because we want to increase product. It's all about the fact that we care genuinely for giving patients what they need. And I have a lot of new patients that don't need anything, and they might have like the best insurances, and they just get a checkup and a cleaning every 6 months. Mm-hmm. Whereas we have patients that might need a lot of work, and we work with them, sit down with them. They need to know their short-term goals and long-term goals. Like, what do they want? Do they want to keep their teeth for the rest of their lives? Do they want to get dentures when they're in their 60s? Like, people have different visions for themselves. So figuring that out, asking them questions. And again, it might sound crazy and rudimentary that I keep saying, like, you got to figure out what patients want, but that's how you really win, because then you know where they stand and really guide them to get to what they want.
If it's what they want, but you're educating them on, hey, this is what's happening. Like, what are you doing in that journey? Like, what tools are you using? Do you have the screen up and you're guiding them through like your radiography?
Yeah.
Your iTero scan, you're showing like the heat maps, the occlusion. What combinations of things are working the best to educate?
I think the main thing is for people to understand the urgency, which we generally don't create that much for things like bite and worn dentition. And anytime I see exposed dentin, it's an open wound. So I talk about it in that sense. It's like when someone needs a root canal, we all jump into like having to do it right away, and it's a big deal. And your whole team knows that. Your front desk team sees root canal on your sheet, they will book that patient in. But when it comes to like occlusal issues where there's worn dentition, it's like, okay, now you can come back in a year and then we'll talk about it. And then 2 years pass and we talk about it. But it's creating that urgency with the patient in the sense that enamel wears down at a pH of 5.5 for acid, whereas dentin wears down at pH of 6.7, which is almost neutral. So patients need to know that. Like when they have exposed dentin, it's not safe. You're going to wear down your teeth about 10 times faster than if you had your normal enamel. So when patients hear that stuff and they see that education behind it, then they don't think it's just like we want to get them into aligners or we want to fix their bite. It's because we actually don't want them to lose their teeth. And honestly, it's been very rare that I ask someone, like, do you care to keep your teeth for the rest of your life? And they said, like, no, I don't care. Like, I'm okay to get dentures. Yeah. So it's very rare. I've had patients say that, and I'm
that was the old school way.
And you know what? Patients don't know. Like, a lot of patients think wearing down their teeth to nothing is normal, and they need to know, like, in 100 years, you should only have about 1 millimeter of wear. That's what's normal. And if it's anything more than that, it's not normal. So I use the iTero for sure to explain that stuff. We use time lapse on the iTero, which is like a before and after.
How cool is that?
It's super cool. Like we had a patient that they had 3 millimeters of recession in 2 years, and the video kept jumping the gums, low and high, and the patient was just mind blown of like they don't argue with you anymore. You're not being like, oh, it was a 2, now it's a 5. Like it's not
with the little mirror. Like,
here,
can you see that?
Like exactly, and then even like showing patients like X-rays. I know this is something that we've been trained to do, but they don't get it. They don't know what tooth you're talking about. You're like, which? So is that you've been talking about the lower right, and they're like, oh, so that was my top left last tooth. I'm like, no, like we're talking about another quadrant. So definitely talking to patients and even orienting them on the iTero scan, because they don't know their teeth outside of their mouth. So like, this is your left side, this is your right side. It's almost like talking to a child, but in a nicer way, where you have to like speak to them eye to eye and understand where they are in terms of teeth. And I think I try to take myself back to before dental school. Like I didn't know any of these stuff that we do. So you really have to see where they are and try to meet them there.
Have you seen that Mr. Bean skit? Where he flips the film,
pan,
and then he flips it this way.
Yeah,
and
it's like, which one?
He's drilling his own tooth.
Oh, 100%. So that's exactly how a lot of our patients feel about the X-rays we show them.
Like you're doing everything right, and it all stems from just your passion and just doing dentistry, I think, right? It's you really enjoy your work.
I do, and it's funny because I wasn't super passionate about this. I find passion in dentistry. So I actually wanted to become a psychologist. That's why I went to psychology, and that's why I have this like extroverted, people-loving side that.
But you are a psychologist in your work.
Oh, 100%. I think the dental chair just changed into like a couch that was for psychologists.
They can't talk back to you now, right? They're just listening.
And no, but I do definitely listen to my patients a lot. I really try to understand them. And I think that psychology aspect really helped me find my passion, which was finding patients who struggled years and years not having a dentist that was a listener, that was able to give them what they wanted. So that was one thing. The other is to really look at a big picture. Like I'm a big picture person. I'm a visionary. I don't treat like one tooth at a time. So just finding that I could do things different and stand out from, everyone else was really something that gave me passion.
This has been amazing. Thank you so much for coming in.
You.
What else? Like in coming into this conversation, was there anything top of mind that like I hope we talk about this?
I think I just love to be able to educate doctors to do better for their patients. That's one thing, and that's why I'm on this mission of traveling everywhere and try to get this out there from a more human perspective of I'm no different from the rest of you guys. Like I'm not a genius. I just really love what I do because I really see I can change lives and influence people. And such a fulfilling profession when we look at it that way, and the burnout goes away because you just feel so purposeful and passionate, and you have a fulfilling career. It's not just about like filling teeth, because no one cares about the MB2 we filled on a root canal, but people really see their smiles every day, and they see when we connect with them and they feel comfortable at the dentist and they're really excited to come see you. These are things that really changes people's lives. So that's something that I love to share with people as well.
Beautiful. I love it.
Thank you.
Thank you so much for coming in.
Yeah, of course. Yeah. It was great.
All right. We'll do this again, right?
Yeah.
Yeah.
Thank you. Can I take this off?